Ready? All right, here we are with Larry, one of our favorite patients. Larry is 55 years old, sick body. We did liposuction 7 years ago.
7. Mm-hmm.
I mean, really amazing. He's got amazing anatomy, but now we're at that place 7 years later, and we're just going to spend 45 seconds talking about, do we do liposuction body banking or do we do Coolsculpt? So what I'm going to say, I told him that there's not a lot of fat here. We pretty much took almost out of it. This was actually before I was doing body banking, so I didn't bank any of the fat anywhere. We just took the fat out and threw it away, which I hate to do because then things can pop out other ways. That's why I don't like to not bank it anymore. But I was saying we could do some liposuction back here, but then Kaylyn's talking about what kind of percentage improvement that she can have with Coolsculpt. Go ahead, Kaylyn.
So, like Dr. Steinbrech said, a lot of our patients will come in and they're like, this is what bothers me, and we're like, actually, this is skin. So, he knows that as we get older, our skin stops.
Yes, it is rear end.
We break collagen.
It's like a horse. Go ahead, keep going.
So, a lot of this on the side is skin, but what we can address is the posterior. So
that's what I want.
Anything that you can feel, like that pinchable fat and the.
So what percentage improvement do we think we can get with that?
Exactly. So we were talking about like Coolsculpting versus like a little bit of lipo revision, which would also be easy. But with the Coolsculpt, a lot of this is scar tissue and a lot of this is skin. So generally you get a 25% change with Coolsculpting. This we're looking at more about a 15 to 20% change.
And then what can we do in terms of tightening procedures? What would you recommend?
We have a lot of non-invasives. We're pretty good about that. We have Ultherapy, which is ultrasound skin tightening. We have radio frequency skin tightening. We have a little more advanced skin tightening that goes underneath the skin. But we always recommend debulking first. So in this case, what we would do is we would try a cycle of Coolsculpting, knowing that it may or may not give us the result that we're looking for as far as the full reduction, and then maybe go back and do a tightening procedure after.
Maybe Fractura?
Exactly.
Is that also
Fractura is a radiofrequency skin tightening option. So it combines heat and needles to help stimulate your body to build collagen, and collagen is what makes everything tight.
Perfect. All right, turn around. So this is Larry. He's a great guy. So what
He's
we're
the
talking about
the best in New York.
Yes.
And he doesn't
No, there are a lot of really, really good people in New York. Don't listen to his lies.
No, he's
It's
the
for
best.
ASAPs. A lot of great people in New York and all over there. But what we're talking about is male plastic surgery. And where do we go with that next step? So thank you. This is Dr. Steinbrech for ASAPs, Instagram takeover, and male plastic surgery in New York.
Peace out.